Do you know what high blood pressure can do to your body? High blood pressure, or hypertension as it's also known, isn't just a bunch of intimidating medical jargon. It's a real condition that affects millions of people worldwide. It's like a silent intruder, often showing no symptoms while it wreaks havoc on your body. At its core, high blood pressure is when the force of your blood pushing against the walls of your arteries is consistently too high. Imagine trying to pump too much water through a narrow hose. You can picture how that might cause problems, right? Now let's break that down a bit. Your arteries are the highways for your blood, carrying it from your heart to the rest of your body. When these highways become narrow or blocked, your heart has to work harder to pump blood through. This extra strain on your heart can lead to high blood pressure. But here's the kicker. High blood pressure often doesn't wave a red flag to get your attention. It's a sneaky culprit, quietly causing damage without any obvious signs or symptoms. You could have high blood pressure for years and not know it, all while it's silently increasing your risk of serious health problems. And when we say serious, we mean it. Uncontrolled high blood pressure can lead to heart attack, stroke, kidney disease, and even vision loss. It's a leading cause of heart disease and stroke, two of the deadliest health issues we face today. But don't let this intimidate you. Knowledge is power, and understanding what high blood pressure is the first step in taking control. It's not about scaring you, but empowering you to make informed decisions about your health. So, as we delve deeper into the world of high blood pressure, remember this. It's a silent, often symptomless condition that can lead to serious health problems. But with understanding and management, it doesn't have to control your life. Understanding high blood pressure and its effects can be the first step towards managing it. Ever wondered what causes high blood pressure? Let's delve into the heart of the matter. High blood pressure, also known as hypertension, is often categorized into two types: primary and secondary. Primary hypertension, also known as essential hypertension, is a bit of a mystery. It tends to develop gradually over many years, and the exact causes are somewhat elusive. However, researchers believe that it's a combination of factors working together. Genetics and age play a role. If your parents or grandparents had high blood pressure, there's a chance you might inherit the same condition. As you age, the risk of developing primary hypertension increases. Lifestyle choices also significantly contribute to primary hypertension. Consuming a diet high in salt, being overweight, lack of physical activity, and excessive alcohol consumption can all lead to higher blood pressure. Stress, though often overlooked, is another contributing factor. Chronic, long-term stress can put your heart under constant pressure, resulting in higher blood pressure. Then we have secondary hypertension, which is usually the result of an underlying condition. It appears suddenly and causes higher blood pressure than does primary hypertension. Conditions like kidney disease or hormonal disorders can lead to secondary hypertension. Certain medications, such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers, and some prescription drugs, can also cause secondary hypertension. Even pregnancy can lead to temporary hypertension. It's important to note that high blood pressure often doesn't show any symptoms. That's why it's referred to as the silent killer. Regular checkups are crucial to detect and manage it early. In a nutshell, the causes of high blood pressure are varied and can be a complex interplay of genetics, age, lifestyle choices, underlying conditions, and certain medications. It's not always in our control, but understanding these causes can certainly help us make better health decisions. Knowing the causes can help you understand why it's essential to keep your blood pressure under control. High blood pressure isn't just a number on a gauge. It can lead to serious health issues. Let's take a moment to delve deeper into the potential fallout of this silent enemy and why it's important to keep it in check. High blood pressure, often known as hypertension, is not to be taken lightly. It's like a ticking time bomb, quietly wreaking havoc within your body, often without any immediate symptoms. One of the most severe consequences of high blood pressure is heart disease. As the pressure in your arteries rises, it becomes harder for your heart to pump blood efficiently. Over time, this strain can lead to the weakening of the heart muscles and ultimately result in heart failure. It's a chilling thought, isn't it? But the risks don't stop there. High blood pressure is also a leading cause of stroke. Picture this: the high pressure can cause a rupture in the blood vessels in your brain, or even cause a clot to form. Either scenario interrupts the flow of blood, depriving your brain cells of oxygen and nutrients. The result? A stroke, which can lead to lasting brain damage or, in the worst-case scenario, be fatal. Now let's talk about your kidneys. These little organs play a big role in filtering waste from your blood. High blood pressure can damage the blood vessels in the kidneys, impairing their ability to function properly. Over time, this can lead to kidney disease, which is as serious as it sounds. So you see, high blood pressure is more than just a number. It's a silent assailant, slowly straining your heart, endangering your brain, and threatening your kidneys. And these are just a few examples. Hypertension can also lead to a host of other health issues, including vision loss and sexual dysfunction. The risks are real, but the good news is there are ways to manage high blood pressure and reduce these dangers. Keep watching as we delve into how you can diagnose and treat high blood pressure in the scenes to follow. So, how do doctors diagnose high blood pressure? This question might be swirling in your mind as you try to make sense of this complex health issue. Well, let's break it down together. The process starts with a simple, non-invasive test using a device known as a blood pressure cuff. This is an inflatable band that wraps around your arm. When inflated, it squeezes your arm, momentarily stopping the flow of blood. Then, as it deflates, a healthcare professional, or sometimes an automated machine, measures the pressure in your arteries. This measurement consists of two parts. The first number, called systolic pressure, represents the force your heart exerts on the walls of your arteries when it beats. The second number, known as diastolic pressure, is the pressure in your arteries when your heart is at rest between beats. Now, you might wonder, what's a normal reading? Well, an ideal blood pressure is generally considered to be around 120 over 80 millimeters of mercury. If your reading consistently stands at 130 over 80 or higher, it's likely you have high blood pressure. High blood pressure is divided into stages based on these readings. Stage 1 hypertension is defined as a systolic pressure of 130 to 139, or a diastolic pressure of 80 to 89. Stage 2 hypertension, on the other hand, is a systolic pressure of 140 or higher, or a diastolic pressure of 90 or higher. Keep in mind, a single high reading doesn't necessarily mean you have high blood pressure. Many factors can affect blood pressure, including stress, caffeine, and certain medications. That's why doctors usually require multiple readings over time before making a diagnosis. It's also worth noting that there's a condition called white coat hypertension. This is when your blood pressure is higher when taken in a medical setting due to anxiety. This is why home monitoring can also be useful in getting a more accurate diagnosis. Getting a diagnosis is the first step towards managing this condition. Remember, knowledge is power. The more you understand about your health, the better equipped you'll be to take control of it. The treatment for high blood pressure involves more than just medication. Indeed, there's a whole spectrum of options when it comes to managing this condition, which we'll delve into right now. First and foremost, lifestyle changes can play an instrumental role in controlling high blood pressure. This could involve altering your diet to be low in salt and high in fruits, vegetables, and whole grains. Regular physical activity is another crucial piece of the puzzle. Whether it's walking, swimming, or cycling, getting your body moving for at least 30 minutes a day can significantly help lower your blood pressure. But perhaps the most important lifestyle change is weight management. Maintaining a healthy weight can have a profound effect on your blood pressure levels. For those who are overweight, even losing a small amount of weight can make a big difference. Now, let's talk about medications. There are several types of medications available to treat high blood pressure, including diuretics, beta blockers, and ACE inhibitors, to name a few. Each of these work in different ways to help lower blood pressure. It's essential to take these medications exactly as prescribed by your healthcare provider and never stop taking them without consulting your doctor. Let's not forget the importance of regular checkups. Monitoring your blood pressure at regular intervals allows your healthcare provider to assess the effectiveness of your treatment plan and make necessary adjustments. It's a critical step in ensuring your blood pressure stays within a healthy range. Lastly, it's important to remember that treating high blood pressure is not a one-size-fits-all approach. What works for one person might not work for another. That's why it's essential to work closely with your healthcare provider to develop a treatment plan that's tailored to your specific needs. With the right treatment plan, it's possible to control high blood pressure and reduce its impact on your health. So let's not underestimate the power of lifestyle changes, the effectiveness of medications, and the importance of regular checkups when it comes to treating high blood pressure. High blood pressure can be a silent threat to your health. We've spent the last 10 minutes delving into this subject, and I hope by now you understand just how important it is. Let's take a moment to recap the key points we've discussed. High blood pressure, also known as hypertension, is often called the silent killer. Why? Because it doesn't always have noticeable symptoms, but it can lead to serious health complications like heart disease and stroke. That's why regular checkups are crucial. Regular monitoring can catch high blood pressure early before it becomes a major issue. We've also discussed the various causes of high blood pressure. While some, like genetics, are out of our control, others, like diet and physical activity, are within our grasp. Making healthier lifestyle choices can go a long way in controlling your blood pressure. Incorporate exercise into your daily routine. Opt for foods low in sodium and high in potassium. Limit alcohol and quit smoking. These are small steps, but they can make a big difference. But remember, lifestyle changes alone may not be enough. If you've been diagnosed with high blood pressure, it's critical to follow your healthcare provider's advice. They may prescribe medication to help control your blood pressure. It's important to take these medications as directed and to communicate any side effects to your doctor. And finally, we've talked about the importance of being proactive. If you suspect you might have high blood pressure, don't wait. Seek medical advice. Early detection and treatment can prevent the serious complications associated with high blood pressure. We've covered a lot today, but remember, this is just the beginning. There's always more to learn and more steps you can take to manage your blood pressure. Keep educating yourself, keep making healthy choices, and keep checking your blood pressure regularly. Remember, knowing about high blood pressure is the first step towards controlling it. Take control of your health today.